If you're ready to scale and expand your healthcare solution rapidly, then you know hiring is not about speed. It's actually taking longer time to do the process of hiring so you can truly retain for the right talent to place in the right role and have the right resources. Today, we talked to Adam Lewis, the founder of Apploi, to unpack how can we use AI-generated workflow to improve the process of selecting these amazing team members as you scale, because you cannot afford to constantly having employee turnover. We talk about what real onboarding success looks like, especially within the first 90 days. Let's dive into it.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
Welcome back for another episode. We're at Point Click Care Summit today, and then so excited to have Adam here with us. One of the major passion of myself has always been how do we lead with passion, with high performance, and yet at the same time have that resilience to continue to grow, continue to be innovative, and be open-minded enough to see there are multiple dimensions of who we are as a person. And sometimes the lack of forward motion is actually just that in alignment in what you think things should be done, what other people's vision is, what the true purpose is. And we get lost in the shuffles and buffles of just doing more things. And at the end of the day, it's about human capital. And then whether that's executive leadership capital or the implementers, right? The managers, the doers. We have to all synchronize that way. And Adam has a really interesting background technology to really solve those problems in hiring within the healthcare staffing. And we know because healthcare is complicated, licensing and getting people continue ed. I just fortunate finished my renewal 10-year board exam.
Oh, nice.
Don't have to think of that for 10 more years.
Congrats.
But if it's a hassle for getting licensing in different places, like myself, still do some medicine, but travel all over. And just having people who want to stay in your organization and not just bouncing back and forth and all over the place. So Adam, tell us a little bit about yourself. How did you get into this niche of anything that you could do in healthcare?
Yeah, no, Sabrina, thank you very much. Appreciate the introduction, and your passion for this is really exciting, and just to be able to chat with you is great. So yeah, Apploi, we've been around for a bunch of years. How did I get into it? I've been in the HR tech side of things for many years, probably 15 years before that. And then about 8 or so years ago, we decided to really focus on the problem within healthcare, because as you say, there is a huge amount of market share, but also people going into these roles are actually really providing care, right? For people that potentially are extremely vulnerable and are relying on the best type of care. And it's complicated, right? Getting a job in certain other industries might be a little bit easier. It's very, very high volume. So like a lot of these companies that Point Click Care is supporting are hiring hundreds of people on a monthly basis, right? Certified nursing assistants, LPNs, RNs, people that are really going to be by the bedside, helping those people that are desperate for that top level of care. And in the US, there's a reality that getting that type of worker into a facility without the right technologies and systems and efficiency can take many, many days. I think the average is actually over 40 days. So, being in HR tech, understanding tools and opportunity for efficiency to streamline workflows for workforce planning, I thought this was really something where there needed to be more innovation. And it was a drive. I've always had a drive to help people like yourself find opportunities, things that they can become passionate about. But within healthcare, what could be better? Because ultimately that job, is really doing something that's the most meaningful work that I think anyone can really do, which is care.
Yeah, at the end of the day, I think we got into medicine, especially the clinical staff. In a sense, we are trained so well on assessing getting to a plan execution. And the mindset has always been just that. However, once you get into the real life of practice, you start seeing all these other layer of interruptions of technology, whether it's helping us or slow us down. Some people debating. And when we have EHRs, then when it just came out, I remember like earlier on in my career, when we gone from paper chart to large EHRs implementation back when Epic just started, Cerner just started kind of thing. And it was exciting, yet, oh my gosh, I'm charging so much more now.
Right.
And the other challenge had been, if I'm putting in an order that I can't even find, is it actually taking me more time to do this than where it was used to be a paper standard, right? And so you putting more burden on the staffing, and we know hiring a physician level, PA level, is usually at least 1.5 to 2 times their salary due to the onboarding, credentialing, training before they actually get to the place they can full on. And nurses is not that much cheaper either. So we have so many issues when it comes to lack of staffing and then the turnover, lack of retention in the process. And it's not just paying people better. There's so much layer into how do we decide if the person is a good fit for the team. And it's also beyond just the simple CV or then credential that letters behind their names.
Yeah. No, I couldn't agree more. I think, as you said, technology has really got to be to enable things and make people's lives easier, right? I think several years ago, people would just be ticking boxes. Oh, we got to get technology in because that's what we need to do. But then what is the utilization? Are people utilizing that software, or are they just going back to using pen and paper or doing things manually? Or to your point, is it actually causing them more struggles? Is it causing more burnout? Because a lot of people within this industry in particular aren't necessarily the most tech-enabled early adopters, right? So for us in our company, one of the biggest drivers has always been to create a platform that is simple and easy to use. That is like the most important thing, because within these organizations, as you know, people who are responsible for hiring and staffing, it's not like they have a corporate office filled with recruiters who are doing it for like every facility. It's the people in the actual facility. There could be an administrator, director of nursing. Those people are juggling like 10 things a day. And recruiting is just one of those things they have to do. They have to make sure that they're getting the right levels of staffing inside the facility. So just try and make it easy. Are they able to use their phone? Are you messaging candidates who may not even check emails, right? A lot of the candidates who are applying for dietary aids, CNAs, they may not be checking their emails frequently. So are you using things like text messaging? Are you mobile enabled? Are you making it simple and easy for the candidates to apply? Are you making it simple and easy for the people doing recruiting to be able to quickly review? And then to your point, all the license verification, the credentialing, the paperwork, right? I mean, I actually still remember in the early days going into an organization, they would have a thick packet of paper that every single employee would have to fill out, right? Print it out, complete it, PDF it, upload it. And then you can understand why is there so many inefficiencies? Why can't you make it simple? DocuSign, electronic signatures, right? So what we're trying to do is just make it simple for the employee and simple for the organization. But at the end of the day, the world is changing so quickly, and I think everyone's going to be conscious of that, right? Us in more of the world of innovation, but also the people that are using these tools. We got to be aware that ultimately change management is hard, right? And we shouldn't be pushing new softwares and systems onto our teams. We should be kind of helping them understand why these things are effective. It's a collaboration, right? In terms of how are we progressing as organizations, adopting new technologies, and obviously with AI, that's just going to keep on progressing in that direction.
Right. It also is able to identify some of the gaps that are already existing in the workflow. So change management is not so much just that, we have a routine and then we're making you do something different. It's actually, how do we interject into the existing routine to make it easier for you? And then the result will come much better or more high quality of the whole experience from the internal staff and the applicants. So tell me more about you guys' software. So does that help people with How does it go from a client journey perspective? What does that look like?
Yeah, so we work within obviously the healthcare industry, post-acute, where obviously we are point-click care is one of our biggest segments. We're in about 9,000 facilities across the country. And what we do is when they implement our software, we basically take care of everything from recruiting. So we're actually integrated with all the different sources like job boards, social media sites, different types of communities of applicants. Everything gets funneled in through our platform, where we're able to kind of get the job in front of the right qualified candidates, make sure that they are correct for the job. We actually check their licenses. We make sure they're verified. Everything, to your point, everything that they would have done with 4 or 5 different steps, we do it automatically, make their lives easier, make it kind of simple, get them scheduled for interview, and then kind of get them onto the second piece of the puzzle, which is the onboarding, right? The documents, the tax forms, the healthcare questionnaires, the credentials, all of that is managed automatically through our platform. And then most recently, a couple of years ago, we added a third product, which we call Employee Schedule, which is now once you have the employees now in the organization, how do you optimize those people in terms of the best schedules for them, right? So what's the best schedule for the organization? How does that link to your needs, right? What's your census? How many patients do you have? How does that link to how many types of employees you need to care for those beds? And then how does that impact your budget, right? In terms of, are you using contingent workers? Are you using full-time workers? So we basically our platform manages that entire life cycle for the organization. Obviously, many people are involved in using our platform on a daily basis, but everything from finding the candidate to onboarding them and then really retaining them through helping them understand how they can find the best shifts and make the best schedules for them. Coming out of COVID, as you know, a lot of these organizations were very, very reliant on contingent workers, agency workers, which really was very tough, for the organizations in terms of from a financial burden, but also from a level of care. Having people switching in and out of the facility on a daily basis does compromise care levels, right? Having some sort of consistency is obviously very, very appreciated. So our platform really kind of helps that transition. So streamlining your people, making sure that they can have flexibility, but still be full-time, part-time, per diem, and really do their best work. To your point, right? One of the most important things is how can you lower turnover in the industry, right? These people are heroes. I mean, the people that, that are bedside day in, day out, they're the people that we should be celebrating. It's not just about what they're getting paid. It's about how they feel appreciated, the level of engagement they're getting, the ability to have some flexibility, like when they're working, what shifts are they doing? It's a 24/7 job, right? So trying to making that easy for the organization, but of course also for the employee. That should really provide the best results in that they're not just going to turn over and look for another job. They're going to stay, they're going to grow, and they're going to develop at the organization.
Right. Scheduling is definitely one of the critical things, even for all of us who still go back to clinical medicine here and there. And they're definitely looking at where do we support, but at the same time, do they have enough shift get covered, right? There's also, I believe, a difference between when you have a physician scheduling versus the nurses, CMAs, and whatnot, because for me personally, when people are asking me to even do a locums job, I never fill out my own paperwork. I upload everything in the Drive already with every single state license, a period of time, whatnot. And then the companies need to fill out for me because there's a level of time constraint when we applying to this versus a lower level of staffing that's cost lastly per hour. Then there's what you guys have to be able to build all the AIs to form all together, then you just simply streamline, right?
Yeah, I mean, it's complicated because, just the documentation, the credentialing, allowing these facilities to think a little bit differently about how are they staffing their facilities. I think you don't need to be so rigid in terms of having the same people doing the same shifts on a weekly basis, having that kind of conversation, but obviously doing that at scale. So it can't be done through Excel and it can't be done through pen and paper. A lot of errors, to your point, if you're filling out the same documents every time, it gets very cumbersome for everybody. Mistakes get made. It just delays process. And I think if you ask any operator here, what is your biggest challenge? They're all going to say staffing. At the end of the day, I actually think getting beds filled and census in the organization is easier for the organizations actually finding the staff that they need to appropriately care for them, right? Making sure that you have the right levels of staff for the levels of acuity of the patients in the beds, right? And at the end of it, there's no way around it. People deserve that level of care and they're obligated. And I think the employees deserve that level of respect to be able to have that kind of collaboration with their employer And so by being able to provide the tools to do it is very, very impactful. And it takes out a lot of mistakes, and it takes out a lot of those kind of like pain points and stumbling blocks. And the goal is just to really get your people to feel more engaged, find the right work that they need to find, and do it very streamlined, just from a phone, pick up the phone, look at what shifts are available, and not have to kind of do those repetitive tasks time and time again. The schedulers at the facilities, right? Again, it's not something that they're able to kind of just get trained. It's not like they have degrees in scheduling, right? They're just trying to make sure that they have those appropriate staffing levels. So why can't AI or automation build these things out as a starting point, and then they can come in and make some edits, and it just takes out 2-3 hours of their kind of work at 12 o'clock at night, when really it should just be done in a much more efficient way.
Right. And as a core, that really tap into how we project what any new innovation or project is being managed, right? There's 3 major levels. Is your physical, emotional, and spiritual. The spiritual are the people, right? The culture, the being, the belief, the mission behind whether it's long-term care, short-term care. What do you believe this organization can provide for the patients? And part of that is making sure that you have enough staff to support all the patients, because it's such a burden if you assign one staff to too many residents, then they don't even have time for anything, right?
Yeah, and it's a burnout, right? At the end of the day, obviously, it's obvious that the patients aren't getting the care they need, but really for the employees, it's burnout. Again, we at our company started something which is one of my most proudest things that we've done at Apploi. It is really nothing to do with our software, but every year we actually recognize the best employees out of all of our customers, right? We get people to nominate. It's actually out of any healthcare organization. We get hundreds and hundreds of nominations, right? And you just read these nominations, applications as to why this nurse or aide or carer, deserve this type of recognition. And it just blows your mind, right? I mean, this is a very, very hard industry. It's a very, very hard job. It's the most impactful job, but it's day in, day out, right? It's caring for people that can't do a lot of things, obviously, by themselves. It's a lot of patience. It's a lot of, ability to kind of really feel that you're giving to someone else, day in, day out. And so if you're working too many shifts or you're spread too thin, that's going to obviously break the person down very, very quickly. And the burnout is very, very real. So making sure you have the right staffing levels is obviously very, very critical, for the people inside those beds, the patients. But it's just as important for the employees if you want them to stay, right? And rehiring, retraining, it's very, very costly. It just means that there's going to be more and more weeks that go by where you're not going to be able to provide the levels of care that you need. And so being able to retain your talent, help grow them, like that's another thing that I really am very interested in exploring more and more deeply, is how do we help some of these folks grow within their own career, right? So if you are a CNA today, what's your career path to getting to, an LPN, to an RN, right? That we need to do more as an industry to help people kind of grow and develop, within their space.
Right. And it's the same when we build these executive leaders for these organizations. The job description is beyond the typical description. And you need to think the same way as when you hire MAs, CRNAs, like any kind of a medical assistant level as well. So
that's even more important, I would say.
It's even more important because if they don't have a clear picture what that looks like, then some people resort back to, this is not what I'm supposed to do because it's not part of my job description. And so then they don't have the clear transparency of knowing how to perform better. So the other thing that we usually add to those description is, how would you feel like you're actually winning in the next 90 days, because that onboarding period is so critical. So we actually itemize how they would be able to achieve these benchmarks. Because if people don't have a goal to hit, then they're all over the place. Yeah. And for your point of having these nomination awards every year, help people to drive for, hey, there's something better. I want to be. People love to be recognized and feel that achievement. And then another thing we write in usually in our description is, what would make you feel good in this job? Right. And then have that aligning to who they are as an individual. So when they're applying, they're not just like, this description sounds good, I can just do the job. Yeah, this milestone I can definitely hit. But what about that self inner drive? A lot of time that's missing is we say resilience has to have the inner lightness that you show up, and that's your desire zone. That's things that you just love to do. You don't motivate your staff. They are self-motivated. They're already there with the core value you embody, not just that, oh, I have I care value. People needed to learn what that is and embody that. Right? That's forced. So on top of that, we make a suggestion on how do you best communicate with your upline of managers and organization leader, because at the end of the day, they are leading the mission, right? And how everybody else able to support them. Now you know if you can support them on the larger scale, right? Some from bottom up and then top down, also understand how you function, how to support you. So you become more of a joining collaboration work. Now, when people are missing that step, then it does feel like I've been doing so much, right? Like I've been caring. But we also know from even the 5 love languages, they also have a 5 appreciation language, right? Everyone has a different take on what it means for them to be appreciated. It's not so much on an end of year bonus. It could simply just be, hey, there's some trouble on the team. I just want you to hear me out, right? And those type of words affirmation, as well as, oh, I see you're staying late doing charting. Is there anything else I can help you with on your patient side so you can get things done so we can all get the next shift started, right? So I feel like HR definitely is a complicated thing. Yeah, it's not that complicated. There are just fundamental things we have to assess, evaluate, and then get people to the place that they believe this is a true career. There's a ladder that they can advance, to your point, right? What does that even mean? What could that offer be? Right? Many facilities are willing to pay people to go back to school. And when you do go back to school, then you just have to give so many years back to the organization, right? So I believe there's so many different ways that we can look at this thing.
Yeah, I mean, at the end of the day, it comes back to a word you said, people. Human resources, humans, right? These are people. When you look at your teams and you look at roles and jobs as what does it mean for us as a collaboration with my people, then I think you're going to get these right types of outcomes that you're describing. When you look at them as people just checking a box, doing a job, that's where it falls flat, right? Especially when you're talking about high volume, maybe slightly more entry level types of jobs. It's really about what's the aspiration? Like, what's the goals? Right? Where are you heading? What's the direction? It starts, to your point, with the job description, right? If the job description is a very flat, like these are the roles, these are the requirements of the job, 6, 7 things, A, B, C, D, E, F, G, then you're going to get the employee into a role and they're going to just be checking off their list, right? These are things I'm going to be doing.
Yeah, because it's about mimicking, right? What do you show up is exactly what people see.
What you're presenting.
What's presenting. So whatever misconception we think we're creating is actually still back on us, right? The organization.
And I think this is where healthcare really needs like a massive boost. Right? If you look at other industries that are hiring high volume types of people, even like retail, right? You and I see TV ads for like jobs at, say, Target, right? You never hear the ad saying, oh, come and work behind the cash register, right? They show a great, exciting career in retail and speaking to people and going into management. And yeah, you're still starting as a, someone on the store floor, but the way they're describing the role and the opportunity is much more aspirational. I think healthcare, particularly in the world of long-term care and post-acute, has got to do a better job at showing, look, this is an incredible industry. It's actually the most fulfilling job you can get, right? And you're going to obviously get paid, but you're going to also get these amazing additional opportunities for growth, and you're going to be doing amazing work. I actually remember once I was at a conference where one of the heads of HR was saying that different things they've been able to achieve for retention that haven't really cost the organization much. And one thing I always remember is she said that they offer their nurses the ability to procure diapers through their organization, right? Obviously, they're getting a really good price.
Yeah.
Some of those people are mothers or parents or whatever, their grandmothers even. And just to be able to get that discount, right, and being able to buy the diapers through the company, it doesn't cost the company anything, but it's just an amazing, innovative idea, right? Yeah. It just shows that we care for you. You're part of our family. You're not just someone who's getting a paycheck. We want to help you, right? And so I know people are very, very constrained financially, right? Especially within healthcare, but there are ways that things can be done that go beyond just that kind of very static, rigid relationship, right? And I think it's about people. Right? I actually like calling HR the people organization as opposed to the HR department, right? Because it's all about the relationships. To your point, if you understand this is the job today, this is where I can grow, this is the skills I can learn, this is kind of how I'm feeling appreciated and fulfilled as a human being. That is very, very important. And there's been many, many studies actually show that is more important than even the compensation that they're earning.
Yeah, exactly. We always believe in human capital is the true driver for your financial capital. And then in between of them is your social capital, right? You need to have the right people representing your company to do the core of the work, as well as the promoters, the people who truly become your champions, say the right thing, and not creating different storylines of different perception. And then that help with conversion, closing the deal, and then truly carry out what really meant to be for this organization. And then that is where we start seeing going away from burned out to this spaciousness of become even more innovative. Because if we're doing so much things, that's actually like you're building a fire, you're keeping adding more wood on there, but the fire is already down, right? Yeah. It's small. Just because you're putting more wood, it doesn't mean it's actually
because you need people to be part of that conversation, right? Yeah. Again, if it comes back to just like do this, and this, then those people are going to see themselves as an employee. Yeah. I'm going to turn up for my job, and at some point, it's just going to be like, oh, I'm stuck. I want to burn out, right? Yeah. Versus, even if they're a lower level in the organization, listening to them, building up trust, listening to where they're struggling, where they're seeing opportunities, and you'll actually be surprised that the ideas that those people on the ground will give are probably some of your best ideas that you'll ever get from the organization.
Yeah, you see it from the bottom. They're in the trenches. Of course, they probably can create even better ideas than you as a leader already on a different playing waveform.
Yeah. Yeah, and they will actually feel much more engaged to do more, right? Yes. To your point, they will actually want to do more. And in this industry, that more is critical. It's critical care. Right, it's not just about how many more dollars the organization is making, like in pretty much every other industry. This is is that person going to get the care that they deserve? And in the post-acute space, like those people really need those advocates, right? Yeah. They need that they are struggling with a lot of vulnerabilities, and to have a nurse or a CNA that just really cares for that patient will make the massive difference at probably the time when they appreciate it the most.
Yeah, exactly. And now I want to switch back and let's shine some lights on your company. So how many facilities do you guys are working with right now?
We're working with 9,000 facilities.
All throughout the country?
All throughout the country. We have different care settings that we work in. Long-term care post-acute is one of our very big ones. We have many, many skilled nursing facilities. Point Click Care actually sells our platform into the market, which is great. They're a great partner for us. We actually have a really nice integration with them, which is very helpful on the scheduling side, because at the end of the day, you need to tie up your staffing needs to your census needs. So those things are going to talk together. So EHR and the data coming from the census directly into the schedule, building on those budgets, something that happens automatically in our products. So that's really exciting for the industry. And outside of that, we're very focused in other care settings like home care. We actually have started really penetrating behavioral health, which I know you're very passionate about as well. And it's, again, it's very fulfilling because we're effectively putting the people into positions to be helping people that need the help.
Yeah. And what's the rest of the year's goal? Where are you guys heading?
Just kind of more of the same. We're trying to, obviously innovate. We've got a big focus on AI, right? We think AI, everyone knows, but AI is happening so super quickly. And I think that has so many impacts for us, for our companies, our customers, and also the candidates and employees at these organizations, right? To your earliest point, it's not reinventing the wheel, right? It's trying to take the same processes and workflows that these people and organizations have always done, make them faster, make them more efficient, make them more accurate. And obviously, I think that will actually spare so much time for everyone involved within the ecosystem, right? Even if you're looking for a job, make sure you're speaking to the right person, right? If you're interviewing unqualified candidates, that's not good for you as a hiring manager, obviously. And it's actually not very good for the candidate either, because that candidate could be looking elsewhere. It's always nice to make sure everyone's really focused on the right thing. So for us at the company, we're very, very focused on data, on AI, and just trying to provide like solutions that make it easy and streamlined to get these employees into the role and retained.
Yeah, perfect. As we wrap up, I always like to ask a fun question.
Yeah, go ahead.
All right, so we're going to give you a magic wand. A magic wand grant you 3 wishes. And you can use anything within your company or healthcare in general. What would you use the magic wand for?
Oh, wow. Okay, well, number one, I would love, it's got to be, I would say within healthcare, it's got to be more treatments and more cures, right? And ultimately, less people in beds and more people living longer, healthier, happier lives would be obviously an amazing, I think, one to use the one for. You say in healthcare or even outside?
Your company and healthcare in general.
So my company, I think, would be to being a really good place for our employees to have impactful work. We've talked a lot about healthcare workers, but obviously we have, a lot of employees of our own. So I want them to feel fulfilled. I want them to feel appreciated and to be able to do great work and to see us as a great employer and as an organization that can really make the impact. So allowing, I would say, for employee growth, engagement, and allowing our company to continue to innovate and to really do great work. And in general, I'm a husband, a father of 5, and obviously everything starts at home. And you can do amazing work for hundreds or thousands of people outside in the world, but making sure your own family are healthy and mentally healthy and physically healthy and happy. I've got to use one of my wishes for that as well.
Fun. Yeah. One thing I always talk to leaders and executives is we needed to reset ourselves in between each segment of engagement, right? Whether it's coming to this interview and then you're going to go outside, go networking, you reset to bring the new energy. Same thing before we go home, before you get out of that car even, right? How do you quickly reset? And for positive intelligence, we always say you can even just do a 2-minute, very intentional
It's so critical.
reset.
Yeah, to be honest with you, now I work hybrid. So I'm sometimes working at home, actually sometimes working, obviously in the office or traveling. The one thing about not working at home, actually, that I really appreciate is that commute back to the house, right? It's kind of annoying because you're wasting time commuting. But on the other side of it, it is that ability to reset. You've left work, you're now going home, right? In my case, I've got these kids that, need my attention, even after spent hours doing all sorts of things, and being able to being very purposeful and focused, right? Versus walking out of my office in my house straight up into the hustle. I do miss that reset. But so I totally agree with you. Switching between gears, it's hard and it's needed, right? And honestly, we struggle that, I'm sure everyone does, right? On Zooms, right? Every day. The way that we schedule our meetings today was very different, right? Because you don't need any time to really switch between, you're not walking 5 blocks to another office. So you go from 10 to 11, 11 to 12, 12 to 1. And sometimes you're leaving Zoom, going straight on. I literally have days where I don't leave my seat. I'm going from Zoom to Zoom to Zoom. And that is very, very tough because the ability to be able to focus and feel present and feel that, you do have that, new energy, really needs even a 2 to 5 minute reset. I couldn't agree with you more.
Yeah, perfect. I so appreciate you for this topic discussion and for all the work that you guys are doing, leveraging PCC and continue to expand in other areas. I think at the end of the day, all of us are in similar round. We just take a different way to approach. And then it's about how do we collaborate to actually do something better together. And the more that we have these open dialogues, we can truly push things much easier forward. What would be the best way for people who wanted to have a deeper conversation with you?
I'm out there, you can find us. I'm on LinkedIn. I can look up my name, Adam Lewis, Apploi. You can come to my website and reach me. Anyway, my email address is pretty out there. So I'm accessible, and I love to be accessible to your point, right? At the end of the day, getting out into these types of environments, conferences, shows, yes, it's a drain a bit on time because you're not productive in other areas, but meeting people, listening, learning, that's the only way to get better, right?
Awesome.
And that's how you can grow.
Yes.
So, Sabrina, I've loved this. Thank you so much.
Yeah, thank you for joining me and spending some time. For everybody who's listening, watching, whether you're live streaming on our podcast or on YouTube, comment below what are something that you have been doing to elevate your own human capital, and how else can we all support you on that journey. Until next time.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.